Hello, I'm Dr. Swatik Reddy, consultant neonatologist and pediatrician in Miracle Hospital for Women and Children. Today, I am gonna say a topic where what is a normal newborn, what all things to be worried in a normal newborn, and what are not to be worried. First, when do you call a normal newborn? Normal newborn is a one who is approximately under 2.6 kgs of weight and baby is not having any breathing difficulty and baby is accepting feeds, well, is called a normal newborn. So what are the things that we face as a new mothers and fathers? They have many doubts when the newborn is born. Like, first, even the baby is crying, that is a problem. Even the baby is not crying, that's a problem. Baby having milk very frequently every hour, that is also a problem. Baby not having milk for 3-4 hours, that is also a problem. Baby passing stools every hourly, that is a problem. Baby not passing stools for at least 5 days, that is also a problem. And baby is having some bleed or milk production in the newborns, that is also a problem. So I am here to clarify the doubt for you today. So first, when the baby is born and cord is cut and baby is dried, we assess the heart rate, saturation and everything. If the baby is completely normal, we take the baby to mother and try to feed the baby inside the OT itself. And we try to do a breast fall for the baby in the normal cases to establish the feed immediately to the birth. So what normal is? Okay, the first thing is feeding. Feeding part, baby having at least 2 to 3 hourly feeds every time, and baby is taking feed adequately from both the breasts, at least sucking for 5 to 10 minutes, and baby is sleeping adequately for 1 to 2 hours after brief eating, and baby is passing urine at least 5 to 6 times per day is called normal feeding. And weight gain after the baby is discharged, we will assess for the weight gain. If it is increasing day by day, then we can say that the other is having normal milk. So baby is feeding every 2 to 3 hours, but not. And what everyone thinks is, sir, baby is passing stool every time after feed. That is a normal scenario, which is called as gastropolic reflex, which is very laboratory one. After every feed, when they pass a small amount of stool, which will be yellow in color with white granules in it, that is normal. And green stool and yellow stool, both are normal in case of pivots. And what are the other normals? Baby sleeping at least 18 hours per day is wrong. And babies normally what patients complain is, sir, baby is sleeping all throughout the day, but baby is active only at nights. That is the most common complaint which I face. The reason for them is, normally baby sleeps wakes up every second hour and have the feed, even if it is night or day, because they can't differentiate between day and night. So what happens is, we sleep at night and we will keep disturbed every time after 2 hours. That's the reason why we feel like baby is trying more at night. And during daytimes, we will be awake and we will be seeing the watches and seeing the baby. That's the reason why we see that baby is sleeping throughout the day. So that is normal. There is nothing to panic in that scenario. And the next point is, there are two extremes. One is passing stool every second hour, and the second one is baby don't pass stool for 5 to 7 days in a desperate baby is quite common, because everything gets absorbed and they don't pass stool. And these things are important when the baby is not passing stool. They first, your belly should not be distended, should not be bulging up, and there should not be vomitings which are green or yellow in color. If these two are not there, then we can say that is normal baby. And everyone says, sir, baby's head is more warm than the body. That is normal in newborns. So every time, or whoever it may be, keeping a thermometer home will give you a better assumption about baby's temperature. Checking it, because nowadays there are complete digital thermometers are available, and keeping it in a proper position will also establish very much information about the baby's temperature. Second thing is feeding is over, stool routine is over, and skin. Baby skin is very fragile, so don't wipe the baby's parts with very vigorously, which can lead to the removal of the upper layer. And washing the stool very harshly also causes rashes in the perianal area. So just tap it dry, that will be normal. Next points which we take in count is how much times the baby passing urine is not. Baby passing around 10 to 12 times is also normal. And baby not passing urine for more than 5 times per day, then we can say that baby is not getting enough milk. And what are the other conditions? Okay, small pimples on the face is normal, which are called as malaria, white and pustular lesions on the face. That is a normal way. And some people ask, sir, we can see small pimples on the tongue and also on the palate, which are also normal. And when to bathe the baby? Bathing the baby every day, like a quick bath, is okay in case of term babies and HE babies. Weight of more than 2.6 is okay. But always make sure to keep the cord dry and it should not become wet, because wet cord is there is a chance of infection. So please avoid wet cord. And when keeping a diaper also, please make sure your cord is above the diaper, not inside the diaper. And many questions like in our Indian culture, because of the cultural diversity, keeping of kajal is normal. But keeping a kajal or face is okay, but not to eyes, because there is a chance of infection in the eye. And keeping of oil inside the ears, please avoid it, because chance of infection are very high. And the other points which like tying the ropes on the belly and branding, please avoid such mistakes, because they are harmful for your baby. And mainly what I say to my patients most of the time is, sure, vomiting once or twice, like there's a toddler skitouts, is normal. Sneezing 3 to 4 times is normal. Small cough without any pouch around 4 times is normal. And these are the basic common normal features in a newborn.